you look at them, you're like, how are they dressed? What does the car look like? You know, if they have a bright yellow car and they come in with a mini skirt and you can see everything, I mean, that's not an admire. An admirers don't own a bright car. You know, it's very unlikely. My platina patient had a bright yellow car. Now, you could be a pulsatilla and have a bright yellow car, but it's not the more subdued remedies like Nat Mir say. Does that make sense? So you want to observe everything about the person, what they own even, everything. And beyond, obviously, you want to be on prejudice. The more prejudiced you are, the more your vision is polluted, so you can't see the truth of what the person is about. So do a complete review of systems. So you don't want to just say, oh, this is a platina case, take the remedy and goodbye, I'll see you in 6 weeks. You want to do the review. So you want to do the physician thing, like ask all the questions head to toes, and do a homeopathic intake also, not just naturopathic. You want to ask about the homeopathic stuff, like do you have any dreams, you know, things that are weird, all the homeopathic stuff, and naturopathic. So causation and the patient's response are both important. Like if a person comes in and they say, oh, as of 4 months ago I've been sick, ask what happened about 4 months ago. That's the causation piece. And I'll talk about that. I'll give you a case of why that's so important. And then how did the person respond to that? So the cause and effect, they're both important. So you need to take a good case. If patients are on drugs, this is a really important subject. If people are under the influence of psychiatric drugs or street drugs, they're going to be different. They're going to be different. Everything about them is going to be different. They might look and act checked out. They may be totally oblivious to what's happening around them. So you prescribe on what you see. Like really, what's there in front of you. You don't want to think, what was the person's simillimum a year ago when they were healthy? You know, I can do that, actually, believe it or not, I can find the simillimum way faster than Constitution. Because there is something to be said about the way God creates people. Like each person is just different. So I can see that, but then when a person comes in and they sit right in front of me, I'm like, okay, I think the simillimum is pulsatilla, but tell me more. And as soon as they talk, I'm like, no, this isn't a pulsatilla case. They need Helleborus because they have a concussion. Does that make sense? So if a person is a cocaine addict and they come see you, they're going to be, like I had one, and I thought for sure she's sepia. But I mean, she had cuts all over, and she's checked out, completely slow to react. And so I gave her opium, homeopathic opium. And we'll talk about that. So you prescribe on what you see. Does that make sense? Very important. You want to be a stickler with concepts and choice of words. Like a mother brought her teenage daughter and said, my daughter is stubborn. And I'm like, okay, like, tell me how. How is she this stubborn? It turns out the daughter wasn't really stubborn. She was strong, but she was more arrogant than stubborn. So just because the mother said stubborn doesn't mean I'm going to chart stubborn. I mean, that's where you got to be clever. Don't just believe the patient's words on face value. You want to see for yourself, is the person really stubborn? So I talked to the girl, and you know, it was like, no, I don't see stubbornness. I see she's very strong. She's confident. And borderline arrogant. So sulfur, that was sulfur. It wasn't calcarb or silica, which are much more stubborn remedies. Uncover the motivation behind behavior or the impetus behind symptoms. Massimo talks about that, and of course all homeopaths talk about that. What is the motivation behind the behavior? Why is the person doing this? So, example would be if a person is highly religious, you want to figure out why are they religious? How are they religious? If they just happen to be religious, then use the rubric mind religious affections. But if they're religious, they became really religious 4 months ago since the diagnosis of terminal cancer, and then you got to think, maybe they're still, you know, God is calling them. But at the same time, maybe they're in denial. They want to deny their disease. If they're in denial and delusional about what's happening, then use the rubric mind delusion religious, as opposed to mind religious affection. So the motivation behind the behavior is really important. Give you a few more examples. You could have, say, all these three constitutions could get angry. Everyone gets angry for a different reason. And Knox gets angry if you get in their way of doing work, let's say, as a rule, I'd say. They just want to get work done. They're workaholics. Staphysagrias get angry if you show them disrespect because they're queens. They really have this queen attitude internally. And lycopoidins get angry if you want to control them. They are very controlling, and they hate to be controlled. This is kind of funny. Makes sense. So the impetus behind anger, behind the behavior, is important. Ask open-ended questions to really perceive the inner state of the person. You don't want to lead the person. You want to ask open-ended questions. Like, how do you respond? When you're sad, how is it for you? Instead of, when you're sad, do you go and hide? You don't want to ask questions like that. Open-ended. Understand your person's full story. So I had a pulsatilla case who always did well with pulsatilla, but then she had a rash, and came in. She said my pulsatility isn't helping. And it turns out, and I'm like, what happened 2 months ago when the rash came on? And the mother was there. The mother said, well, the grandma died, and my daughter, who was a patient, didn't really grieve properly. So I'm like, oh, okay. So, and as soon as we said that, the daughter choked up. So I'm like, tell me more. It turns out that she hadn't cried after the grandmother died, and she's a sweet pulsatilla. Pulsatillas cry like that. So for a pulsatilla to hold it in for 2 months, that's unusual. And so, and I'm like, skin rash, could it be Sorinum? Maybe, you know. So I took the full case. Sure enough, she had all the keynotes of Sorinum. Give her Sorinum, and I think in 2 days or something, the rash cleared up. Whereas pulsatilla wasn't doing the job. Now, that was her similimum pulsatilla. Again, in my opinion, that was her, what I would call her similimum. The way she ticks deeply. That's the way she ticks. But it wasn't doing the job, because that's not what pulsatilla is about. She was cold, her appetite was funny, and she had this rash, etc. All the keynotes of Sorinum. So it was amazing. By the way, I've had great success with Sorinum for skin problems. This is a little, whatever you call that, clinical pearl or whatever. Don't be fooled by superficial appearance. My reception is kind of gullible, so if somebody comes in, they're smiling, I'm like, what's the remedy? And she's like, phosphorus. I'm like, no, she just happens to be a Nox vomica in a good mood. You know, she's an angry, strong, you know, competitive Nox vomica, but she just is in a good mood, and Nox vomicas usually are in a good mood. So that doesn't make her phosphorus. So don't be surprised, don't be fooled. You don't want to just, don't do the whole visual, don't do my visual homeopathy technique thing. You know, some of my students do that. They're like, well, it's sad if a person is happy and, you know, happy-go-lucky, think of phosphorus and pulsatilla. I'm like, yeah, but anyone can smile. A lion might have a nice smile on before they take that, you know, deer down. So, you know, it's like a Nox can be really happy right before they take your head off in an argument. So you don't want to be gullible. Okay, these are some highlights you can look at. There are so many slides. You have this. So I don't want to read all the slides to you. When you do a follow-up, here's follow-up. When you do a follow-up, you want to do a review of systems again, because the remedy affects everything. So you want to do a complete system of review of systems again and again and again, every time you see them, if you want to do a good job. And I usually want, if someone is psychiatrically disturbed, I want to see them in 2 weeks. You don't give a remedy to someone who's psychotic and say, come back in 6 months, 6 weeks. That's not right. I want to see them in 2 weeks to see what's going on with them. How are they doing? Okay, and what can you expect from the remedies? I would say short-term and long-term. You can break it up to short-term, long-term. Short-term, what I expect from the remedies is immediate changes in energy and mood. I'd say 90% of the time I see changes in energy and mood for the better in the office within 10, 15 minutes. And if I don't, something is going on. Something is blocking. Long-term, what can you expect? With the correct remedy, I'd say at least 60 to 80% improvement overall on all the levels, physically, emotionally, mentally. And sometimes it may take a few months before the patient gets there, especially if a person is really sickly, like a constitutional silica. You're not going to do miracles in a month with a silica. It might take 4 months before they come back with a big smile on their face, like, you know, I've never felt this good before. You can expect a lot from the remedy. Herring's law of cure, hopefully you know all about that. You should know about Herring's law. It applies to all systems of medicine. Mind heals first and then the body, right? Top to bottom, inside out. So asthma gets better first and then the skin, right? Okay, this is something that has taken me a while to learn. If someone has multiple personality disorder, an advanced psychiatric disease, and you give them the right remedy, they might want to weep for a week. Is that going against Herring's law? Because Herring's law says the mind should become happy. Like, and then, you know, who cares if you have a rash break out as a healing reaction? The mind should become happy. If a person is emotionally off, you've given the wrong remedy. That's always been my understanding. Give the remedy, emotions should improve. It's true, that's true. But if a person is advancedly psychiatrically ill, let's say multiple personality or psychosis or something, they might weep for 3 days. And this homeopath from India, Dr. Seema, talks about that. And I've seen it. So I think this is something that I could definitely learn more about. But I believe, and she says it, and I believe it's true, that if that happens, a person weeps for a few days afterwards, and the multiple personality starts to improve, the patient's quality of emotions and mental wellness improves, then it's fine. It is going according to Herring's law of cure. They just had a lot of stuff that needed to come out. So the weeping doesn't make it wrong, doesn't make the remedy wrong. Let's see. Oh, I had just a comment down below. I had a homeopath and a naturopath refer a patient to me in Seattle, and I'm always honored to receive referrals. And I this multiple personality case. When the patient started weeping, the patient got scared, went back to the referring naturopath, and the naturopath said, you know what, we've tried everything, you've even tried homeopathy. I can see you're obviously not doing better, so I think you should get on SSRIs. So the naturopath referred the patient that had seen me to a psychiatrist. The patient ends up getting SSRIs. He felt much worse, so came back to me and said, what should I do? I'm like, I wish I had known that that had happened. If the weeping was okay for a few days, that was expected. So it's your choice now what you want to do. But if you don't feel good with the SSRI, if you want to try it longer, fine. He said, I would like to try it for another few weeks. I'm like, fine. But if you get to a point where you're not happy with how you feel, then stop it. Come back and see me, or come back and we'll talk about what to do. But ideally, you should talk to your medical doctor to get off of that gradually. And then come back when you're clean, and then we'll try again. And that's what happened. And he's totally happy with the remedy, which is cannabis for a multiple personality case. It totally focused the mind. He was much, much happier. So, all right. And patients, as all your homeopaths know, patients have this amazing lack of self-awareness when they're going through the process of healing. When their mind is healing, they don't see what's going on. When they come out of it, when they emerge from that cocoon, the change process, then they can verbalize what's happened. But a lot of times they come back, they're like, I feel better, but I don't know how to verbalize it. So I'm sure you've all seen that if you do homeopathy. This is something that, again, if you're just a pure homeopath, you may or may not, unless you're very experienced, you may miss this. So if a person has, say, hypothyroidism, and you just don't check their blood work because you're not doing physician work, you're just doing plain homeopathy, you might really miss something big. If their TSH is 40 and they're severely hypothyroid, you need to put them on thyroid medication, because otherwise homeopathy does not work. Now, if you are a really amazing homeopath and you say you can help a person like that, great, you're uniquely wonderful, but or capable. But I can't. If a person's TSH is 40, I'm going to put them on thyroid hormone, get the thyroid balance, then give them a remedy. So these physical blocks, you got to really understand that. If a person is anemic, you want to put them on iron. Don't expect the remedy to fill the gap for the missing iron. Very important. So it may take months for you to find the correct remedy, and it may take the patient, months to feel better. So you got to be patient sometimes. You're not always going to see amazing results right away. But I usually see amazing results on the same day, but really that's not in every case, obviously. There is going to be some tough cases. So things come up, people who always bottle things up, the remedy makes them say things that were never said before, so sometimes problems happen as a result. How safe are the remedies? I would say in 10 years of practice, I've had a handful of patients have severe negative reactions. One of them was just recently, gave the remedy, the next day the patient passed stones and she was hospitalized. And of course, thankfully, she wasn't going to sue me. She said, obviously, the stones have been here all along. The remedy might have maybe pushed them out, perhaps. And I'm like, well, it's possible. I mean, it does jumpstart the healing, so it's possible to push the junk out. But if you want to prevent that from happening, I believe you're far less likely to cause a healing reaction by removing the toxic blockages. So detoxify the patients for like a month. Make sure they at least have daily bowel movements. If a person is backed up, one bowel movement a week, I don't even give them remedies, honestly, because I've had really bad reactions with that. You got to make sure they have regular daily bowel movements, drink lots of water, eat good for a few weeks, think, toxins are coming out, and then you give them the remedy, and then you should be safe, much safer. We treat patients, not diagnosis again. So every case is individual. Okay, this is a family of remedies you really want to know about, the Solanaceae family of remedies. It comes up when you treat advanced psychiatric problems. Please note this. This is such a cool family to know about. The remedies include belladonna, stramonium, hyoscyamus, dulcamara, and mandragora, which I have never known anything about mandragora till recently. It's a unique remedy, but it's good to learn about. Let's go back here again. So according to Dr. Philip Bailey, favorite author of mine, he talks about this family as follows. The whole family is associated with the dark side of the unconscious, with madness, violence, possession, and uncontrolled sexuality. They're really disturbed, these constitutions. And to give you a better feel for it, this is where we go. See Eric right here? He has popped in and out of different constitutions, like Helleborus, Stramonium, Pulsatilla, all over the map. When he's in phase 3, phase 4, and he's an artist, his artwork is so disturbing right here. He drew that, and I made some comments underneath it as to what I think is happening. He's like sinking in water. That's he's that